Good morning, everyone. Today is September 19th, 2022. We are here for the APFA Virtual Retirement Town Hall, and today we are having a special focus on Medicare. With us today, we have Phil Fisher. He's a LaGuardia-based flight attendant, and he's a licensed Medicare agent and specialist, and we are really glad to have him here today to help answer your questions over Medicare. As usual, we have Kim Tuck.
Good morning.
And Patrick Hancock are our retirement specialists who are very knowledgeable, and we're very fortunate to have them here as well. So without further ado, I'm going to hand it over for our brief presentation. Here we go.
All right. Thank you, Josh. And again, good morning. Who we are: Kim Tuck, APFA National Retirement Specialist; Patrick Hancock, APFA Retirement Specialist Emeritus. I still haven't figured out whether emeritus is a good or bad thing. And today we have Philip Fisher, who's a licensed Medicare agent and specialist. So this is going to be, if you've seen some of our prior presentations, we're going to take little pieces from our prior, but this is going to be focused on Medicare. So, oh my God, who are those people?
They're so young.
I mean, really, and that hair. Anyway, all right. So that's who we are. Who we are not is we are not the company. This is a union meeting. And I have been a union rep long enough that I have developed a rather healthy cynicism about my employer. And so if I say something about my employer that insults you because, you know, I'm old and cynical, yeah, well, Oh, we're also not your financial advisor. You will probably need a financial advisor in order to successfully transition into retirement. We're not it, but we recommend you get one. You may also find that, or you will also find, we are not your attorneys. We're not your Social Security advisors. We're not your Medicare advisors, but we do have one to talk to today. But you're in luck because we have Phil who's available to answer all of your questions. Happy to help. All right. Okay. Let's talk about Medicare now.
Okay, so there's several reasons we decided to talk about Medicare now and do this special presentation. One of which you'll see in a few minutes is that approximately 50% of our members are either currently eligible for Medicare, shocking, I know, or they will be in the next 10 years. So demographics show that there's going to be an interest in this subject. The Medicare annual enrollment period is opening soon. It runs from October 15th through December 7th of 2022. And around that time, if you're 64, about to turn 65 or older, and maybe haven't signed up yet, or even if you have signed up, you're going to be bombarded with information about Medicare, and we get a lot of questions this time of year. Also, it kind of coincides with our normal annual enrollment period, and a lot of people wonder if they're turning 65 and they stay on the company insurance, do they go on Medicare? What do they do? So we'll be addressing that during today's presentation. We also get a lot of questions from those members who are getting ready to retire and want to know what they need to do if they're not yet 65, but will be turning 65 soon, or if they are already 65 and they haven't signed up for Medicare and they want to avoid those late enrollment penalties. So here's a slide of our membership by age, and I'm going to let Patrick talk a little bit about our demographics.
All right, so as of May 2022, we had 24,312 members. How many of those do you think were over the age of 80? 80. You're wrong. We have 14 flight attendants, age 80 and older, still actively flying. I actually flew with one last month, and she was delightful. So, but 75, 79, 125, 70, 74, 459, 65, 69, 1,543, getting to be larger and larger groups. 60 to 64, 3,731, and the largest group, 55 to 59. That's 11,191 that are age 55 and older. And almost all of them are eligible to retire today. So, yeah, if it seems like your union is spending a lot of time, effort, and energy on retirement and now Medicare and Social Security, that is the reason why. Because it's important and it influences a very large percentage of our membership. Let's look at the rest of the demographics, round that out. You'll notice it gets kind of small as we get down into the younger people, like this group. But, you know, if you look at age 35 and below, they're a huge group too. So it's I like to think of our demographic distribution as barbell shape. Lots on one end, lots on the other, and then just a few in the middle.
He's in that group, but he's the one that knows about Medicare.
Yeah, yeah. He's in that big 34 group. All right. So that's our membership. Let's talk about retirement in a nutshell.
So if you're considering retirement or you're just starting to do your planning, we have a really good normal retirement presentation that goes into details about all of this stuff. But today we're doing retirement in a nutshell because we want to focus on Medicare. So if you're considering retirement, the things you need to think about are as follows. You need to think about, these are the important questions you need to address if you're considering retirement. Are you ready to retire? And readiness comes in many different forms and fashions. It's not just being financially ready, but that is part of the picture. It also includes eligibility, and that's part of what do you need to retire? What about income? That's a huge part of it, as I mentioned before. And what about health benefits, including Medicare, if that's your option? So these are the things we're going to cover in today's presentation. Again, we're going to be short on the normal retirement stuff and a little bit more in depth on Medicare. But if you go to any of our previous presentations, which are available online, you'll find all the information you need there that we're not covering in today's presentation. So, first things first, are you ready to retirement? Are you ready to retire? First of all, you need to be eligible. And eligible, according to the company, it's based on the 65-point plan. We get a lot of questions concerning what is the 65-point plan. And basically, you have to have 10 years of company seniority based on your date of hire. And your age plus your company's seniority must equal 65 points or more. That's the 65-point plan. And what the 65-point plan gets you basically is you get paid out for your the vacation is contractual. So you always get paid out for your vacation if you retire. It's contractual, but you get paid out for your sick time if you're eligible to be a retiree. And you get those all-important flight benefits. Your D2R, which is unlimited, your D3s, which are half the number that you have as an active employee, and your D1s, which are exactly the same as when you're an active employee. So you get your travel benefits basically, and the ability to get paid out for your sick time. You also get a retiree ID, which can entitle you to other discounts in the travel industry, hotels, cruises, rent cars, and you get a fabulous retirement gift. And we have some pictures of that in our regular retirement presentation and our retirement packet. So, are you ready to retire? Patrick, you want to talk about being mentally ready to retire?
Yeah, I tell you, some of those other things, like do I have enough money, have I figured out insurance, those are all pretty objective standards, and you can measure and say, hey, do I meet? Being mentally ready to retire, that's a whole different ballgame. And you know, you have to be ready. And we talked to a lot of flight attendants who've already retired because the company's figured out some new way to screw them. And once we figured that, I go, wait, I got a question for you. Did you go at the right time? Was it good for you? Did you go too soon, too late? And I almost 98, 99% of the time I go, oh, it's the best decision I ever made. I don't know why I waited. My life is so full. I don't know how I ever had time to go to work. Oh, yeah, I don't want to talk to you. I want to talk to the 1 or 2% that aren't happy. Why aren't they happy? And almost universally, it's because they didn't plan. They jumped at retirement. Oh, $40,000, that'll last me the rest of my life. Or they took the sudden out. Sudden out. Yeah, sudden out. That's where the union rep and the supervisor meet you on the jet bridge. And as you're walking up the jet bridge, the union rep says, I got your retirement. I recommend you take it. Yeah, you didn't plan. And those are the people that are not happy. Those are the people that struggle with a lot of the other questions like money and healthcare. I've got good news for you. You are here today. you are watching this video. That means you are planning. You are not going to be in the 2% that's not happy with retirement. So good job. The only question is, have you reached that point? But we're flight attendants. We'll talk to everyone about it. You know, we may even ask our spouse. We'll ask our sister. We'll talk to that non-rev on the jump seat that we've never seen before and we'll probably never see.
That's more like it.
That's probably much more like it, yeah. And because a lot of those people have your best interest at heart, they want you to be happy. And they will give you the advice that's best for them. Because that's the way we work. Yeah. Only you will really know if you're ready. And even then, you may not be 100%. Most of us weren't 100% sure that we wanted to be a flight attendant. Some of us, it was stewardess. So, yeah. But for most of us, that seems to have worked out pretty good because now we're talking about retirement. So, you know, remember that you took a leap of faith because most of the stars seem to line up to go that way. And for most of the people that I talk to who are happy in retirement, they tell me that. I wasn't 100% sure, but I was pretty sure. That's actually pretty good in today's society. An awful lot of our decisions are 50-50, but this one good. And only you will know. Let's go. What about income? Well, funny you should ask. In retirement, you're going to have probably 5 sources of income. Your 401k, your individual return, your IRA, your Social Security, your savings, and if you have one, a pension. And I like to think of having those multiple streams of income is like having the stability of a 5-legged stool. And the advantage is if one of those legs gets kicked out from underneath you, that you will still, I mean, it's not that it's not going to hurt, but you'll still have some stability left because you've got the other source of income. Oh, let's pick on Social Security today. What if the United States Congress were to say, you know what, we're trying to balance the budget because elections are coming. So we're going to say that because you took advantage of the 401k tax savings, or because you had an employer who took advantage of the tax savings by contributing to your pension, we're not going to give you any or as much Social Security. They wouldn't do that. Oh, yeah? Remember how Social Security used to be? You got it at 65, full age. Oh, no. Ronald Reagan and the Congress decided they were going to balance the budget because elections were coming. And so they changed the age at which you would be eligible for full Social Security to stretches out all the way to 67 now. So everyone born after 1960 and later, 67 is their full retirement age. And I think they figured out that by the time we figured out how much it screwed us, they'd be dead. They were correct. They're dead. We figured it out, and I'm still pissed at it. It's fine. So, but even if that happens, you still have your other sources of income. I'm not saying it wouldn't hurt. I'm not saying it wouldn't change your lifestyle, but you wouldn't be totally destroyed by it. And every time I see this list, I'm always happy I work for a unionized workforce where the union is concerned about our people having a safe and comfortable retirement by making sure that all of these options are available to us. I contrast that with the over 50% of people on Social Security that's all they've got. What kind of security is there when your entire financial life depends on the good graces of the United States Congress? Scary place to be. I'm glad I'm in. Hey, what do we got about medical insurance options?
Okay, so when you retire, you've got several medical insurance options, but really this is the main thing that drives people to stay on longer until they're eligible for Medicare, because while we do have options, people don't always think that they're the best options. So what are our options for medical insurance when we're ready to retire? Number one, COBRA. COBRA is a way to continue your active medical benefits, the exact same benefits you had as an active employee, but you pay the full cost. So if you look at the dollar signs there, that's a pretty expensive option, and a lot of people find it onerous. Another option is the AA retiree medical insurance. Look at all those dollar signs. It's ridiculously expensive. I think it's a little bit under, what is it, $1,700 a month?
Yeah, $1,700 a month right now, but I think it's going up.
I think it's going up to $2,000 a month for 2023, around that for one person. So it's a very unstable form of medical insurance. It is the old contractual pre-bankruptcy medical insurance that we now have to pay the full price for. And there aren't very many people in the plan, which is why it's unstable. If someone has a lot of expensive health claims, it goes up for everybody the next year. So there aren't a whole lot of people. I think there's maybe only 45 people company-wide who are enrolled in this plan. It's good coverage, but it's very, very expensive. All right, so another option is the Affordable Care Act. It still exists, stay tuned, but actually there's an administration who appears to be trying to beef it up a little bit, but well, a lot depends on the states where you live as well. So you can go to www.healthcare.gov and find out which plans are available in your state. And this is probably, after COBRA, going to be the best bet for people who are not yet 65. Oh, and I forgot to mention about the retiree medical insurance. If you decide you want to spend that money, it's only available to people who retire between the ages of 50 and 55 and are not yet eligible for Medicare. They also have to qualify for the 65-point plan. All right, so Medicare. If you are 65 or older, this is going to be your option. A lot of people think, well, I like my current coverage. I could just choose COBRA. But if you're eligible for Medicare, COBRA is always secondary to Medicare, and it's not considered creditable coverage. So if you were to try and use it, it would pay as though you signed up for Medicare, whether you had it or not. Not a good idea. Once you're 65, the COBRA and the Medicare, the COBRA medical, I should say, and the Medicare don't necessarily play well together. So Medicare is going to be your main option once you're 65 or older. And then there's the old-fashioned way. You can marry somebody with insurance or die young, but we don't want to do that. Not really a good option. All right, so we're going to hand it over to Phil, our expert. Thank you so much for coming today and being here with us. And we're going to talk a little bit about the initial Medicare enrollment period. So what do you want to tell us about that?
All right, so the Medicare initial enrollment period, this is when you turn 65. So you can, 3 months before your 65th birthday, you can let Medicare know, I want to take my Part A and B, and for it to be effective the birth month that you are going to be turning 65. So if you turn 65 in November, you can start 3 months before that, starting to get ready for your Medicare plan and for your Medicare to go into effect. That's going to be your initial enrollment period. So you have 3 months before your 65th birth month, your 65th birth month, and then 3 months after. So a total of 7 months to start getting your Medicare set up without any penalties.
I have a question. If I sign up for Medicare 3 months before, will my Medicare start 3 months before?
No, it will not. It won't start until your 65th birth month. So if you turn 65 in November, then on November 1st, your Medicare plan would start, as well as your Part A and Part B.
So it will start on my birth month, the first of the month, but not necessarily on my birthday.
Correct, exactly.
Okay. And if I sign up during the month of my birthday, it won't revert. Will it revert back to the first of that month?
No, it'll get started the following month. So if you sign up for a plan in November, November 1st is already passed, and it'll be effective for October 1st. And then if you start in October, if you start picking a plan in October, it'll be effective December or
November.
November. Wait, did I mess that up?
No. I think you got it exactly. Okay,
Sorry.
I wanted everyone to be aware that if you sign up like during your birth month, it's not going to revert to the first of the month. It's not going to start on your birthday. It's going to start on
Correct.
the first of the next month.
Correct.
Okay,
Exactly.
perfect.
Bill, I've got a weird question about that. So if I have a November birthday, which I just happen to do, and I were to forget to sign up for Medicare until December 10th or so, it would become effective January 1st.
Correct.
Which means I would not have two different sets of deductibles, one for this year and one for next year. I'd only have next year's deductible.
Correct. Because you wouldn't be covered by any, if you didn't start your Medicare until January 1st, then you wouldn't have any kind of coverage other than
Whatever alternate I have.
Exactly.
Okay.
I've got another question. If your birthday is on the first of the month, your Medicare starts the month prior to your birth month?
No, it will start on the first of the month of your birth.
I think I may have read something, we'll double check that if it starts on the first of the month, you do have the option, that's the only time you have the option to start it early.
That may be something that I have
Yeah.
not seen before.
You're the expert, but I defer to you.
I've not seen
We'll
But I
research
feel
that.
like I
We'll
may,
come
I
back
feel
to
like
that.
I may have read that, yeah, we'll
Okay.
come
We'll
back to
circle
that.
around to that.
Yes. Okay, so, next topic. Okay, I'm working, we get this all the time, I'm working and I'm 65 or I'm turning 65. Everybody, my sister, my best friend, everybody and their dog tells me I have to sign up for Medicare when I turn 65, even though I'm still working. Is that true?
No, that is not true. You can actually delay your Part A or your Part B before you turn 65. So if you still plan on continuing to work and be on your employer's health coverage, you can delay that Part B until you're ready to retire. And at that time, we'll go over what to do whenever you're going to be going to apply for your Medicare past age 65. After you're 70 years old and you're deciding to retire, we'll tell you what you need to do in that instance.
Now, if I turn 65 while I'm working, I do have the option to sign up for Medicare, correct?
Yeah, you can sign up for Medicare. Once you turn 65, that's an option for you. It's good to sit with a specialist to go over what your costs are going to be, whether staying on your employer coverage versus going to Medicare. It's good to weigh which one's going to be more cost effective.
And it seems like, from my experience talking to people, that most people do, a lot of people do go ahead and consult with a Medicare advisor, but most people decide that the company insurance is a little bit richer benefit.
Correct.
And so they decide to stay on that.
Yeah, definitely. I've seen that a lot. Also, if you are married and covered under your spouse's employee benefits, and you turn 65, you'll need to check the rules of their health plan because depending on how many employees your spouse's company has, that can change if you're eligible to stay on Medicare or stay on their plan.
I have an anecdotal for that. We had a person take the BOP. She was 78 and her husband was 82.
Wow.
And they went into the Social Security office to sign up for Medicare. And the clerk kind of went white because she says, "You're a little late in signing up." And they said, no, we had employer covered. And that was the first time they went on Medicare at age 82.
Mm-hmm. Wow. That's way past. I've never seen someone that old go to Medicare that late. So in that instance, all you would have to do is fill out a form. We'll go over that form here in a little bit. But basically the employer will help you fill out the form saying that you had credible coverage that entire time past 65, so you don't incur any penalties for not taking your Part B.
Right? So we talked about the initial Medicare enrollment period, which is when you turn 65.
Yep.
So explain what the special Medicare enrollment period is.
Okay,
and
so
when you would qualify for that.
okay, so that special enrollment period, this is anytime you're going to have a life change, just like when you have original health coverage. If you have some big major event happen or in your life, then this is kind of whenever the special enrollment period is. So when you retire after the age of 65, you're entitled to Medicare, the Medicare special enrollment period. We also call it a SEP. You have 8 months from the day your employment ends to sign up for Medicare. Keep in mind, to prevent the late enrollment penalty, you must enroll in Part A and B and provide proof of credible coverage within 60 days. Okay. And that form that we talked about, it's called the CMS L564 form, or the request for employment information. You can send that to the company to verify that you had credible coverage past 65, so you don't incur a Part B late enrollment penalty. You can get the form on the Social Security website, which is ssa.gov. It's also available on JetNet, or
Your friendly APFA
Yeah.
reps will be happy to send you a copy. Okay, so here's a picture of the form so you know what it looks like. The Medicare Employment Verification Form, aka CMS L564. So if you're retiring and you're over the age of 65, we suggest that you go ahead and get this form, fill it out, and you fax it into the company. And you should probably do that not further out than 60 days, because Medicare wants to see that you've had coverage within the last 60 days from when you retired. So usually we recommend people, get the form and fax it into the company, or you can also upload it on JetNet and do that approximately 60 days prior to your retirement date. That way, when you get the form back from the company, it will be dated so that Medicare can see that you've had coverage within the last 60 days.
I actually have a question about that. Which department are they going to send that form to?
They fax it to the benefits department. Alight is the outsourced benefits service center provider, and the fax number is in our retirement packet, and I'll get that for you. The Alight fax number is, let's see, it's 847-554-1884. That's the number that you fax it to. That number is in our APFA retirement packet. It's also available online on the retirement portion of the APFA website, and it's in the previous retirement presentation as well. Okay, so tell us about this, what we like to call Medicare alphabet soup. There's all these components, and it seems really confusing because when we had employer insurance, everything was kind of covered under one umbrella. You had your, your prescription drugs, you have your medical, you have your hospital, everything, kind of your mental health, vision, dental are maybe a little bit separate, but they're also all available through your employer. And when you start signing up for Medicare, you see A, B, D, supplement, Medigap, Part C Advantage plan, and you're like, what does this all mean? So Phil's going to kind of help us decipher the Medicare, what we like to call the Medicare alphabet soup. So what about Medicare Part A?
This is probably the most confusing part of this whole presentation, so bear with me, and it's not the most entertaining either. So you have original Medicare, which we're going to start with Part A. Part A is going to be your hospital coverage. It covers inpatient hospital care. It'll cover skilled nursing facilities, which is usually like after a surgery, nursing home care, and then hospice care, home health care. And then most people, there's not going to be any cost associated with this. As long as you worked 10 years or 40 quarters, then you are entitled to Part A. As long as you work 10 years or what's known as 40 quarters and put into Social Security, you're going to be entitled to this part, okay? There's a lot of deductibles and stuff. We can send you information on that, but we're not going to get into the nitty gritty of each part. We're just going to go over the basics real quick.
So I have a question about Part A. There's a lot of people who decide they're going to keep their company insurance, but they go ahead and sign up for Medicare Part A. Mm-hmm. Does it really get them any benefit?
So the Part A will actually be your secondary to your major health plan. So it doesn't really give you any benefit, but I mean, if you're turning 65 and you're not contributing to an HSA, is that correct? Yeah, an
correct.
HSA.
And the HSA is the health savings account, which is affiliated with the AA Core plan. And it's an account you can take with you when you retire and use it to offset your Medicare expenses. But if you're already signed up for Part A as an employee, you're not allowed to contribute to that HSA. So that kind of takes away the benefit of having that plan.
Right.
So that's pretty much the only time that someone wouldn't want to sign up for Part A.
Yeah, so if you have an HSA and you want to still contribute to it, I would put a big star next to this PowerPoint and say, do not, delay my Part A because I want to continue to contribute to my HSA. If you're done contributing, then I guess it doesn't matter. You can allow the Part A to go effective because it is free. But if you do plan on continuing to contribute, which would probably be a smart idea, then you would need to delay that Part A and Part B when you turn 60, before you turn 65. Again, you can do that 3 months before your 65th birthday. You can start making those requests to Social Security. So the next part of Original Medicare is the Part B. This is going to be for your medically necessary services, such as like services or supplies, wheelchairs, walkers. That's going to be covered under this. And then your preventative services, which is healthcare to prevent illness, detect anything early on,
And your labs and your regular
Right,
doctor's
labs,
wellness visits. and
exactly,
that
that's
good
correct.
stuff.
So your primary care and your specialist visits. Again, Part A and B, they're only going to cover 80% of your costs. You're liable for that other 20%. And again, we can get into that a little bit deeper later. It also covers things like clinical research, ambulance services, that durable medical equipment like wheelchairs, walkers, crutches, mental health, inpatient, outpatient, and partial hospitalization, and then limited outpatient prescription drugs. Okay. We're going to move on to that next part. Probably a lot of you are wondering, well, what about my medications? So the Part D, this is something that you have to get in addition to your Part A and B. Okay. So Original Medicare, they give you Part A, you have to pay Part B, and then you also have to get a Part D. This is going to be your prescription drug coverage. You have to sign, the month that you turn, or the month that your Part B goes effective, you have to get a Part D. If you don't, you can incur a penalty, and that penalty does not go away. So it will cover most outpatient prescription drugs. Part D is offered through private companies, either through a standalone plan or for those that are just on Original Medicare, or you can also get it through a Medicare Advantage plan. Okay, so Part D, you can have Original Medicare and get just a standalone plan, or you can get it through a Medicare Advantage plan. The next thing we're going to talk about is IRMAA.
Who is she?
Yeah, she's not a very nice lady.
She looks kind of crazy.
You picked a good picture for this one. So this stands for income-related monthly adjusted amount. And what this does is it will change your Part B and your Part D premiums based on your income level. So if you make too much money, then they will actually increase those premiums. Okay. So if you owe an IRMAA based on the income you reported on your IRS tax return 2 years prior, you may be able to file an appeal. Okay. And we're going to go over those costs here really quickly. So this is for your Part B. For 2022, your original Part B premium is $170.10. Okay. That's if you file individual tax return. We have file joint tax return, and then we have file married and separate tax return. As you can see, each column, it will tell you $91,000 or less for a person who files individually. They're going to just pay the $170.10.
That's for 2022.
That's for 2022. We don't know what 2023 is going to give us yet,
We're still waiting.
You can bet it's going up. It's been going up every year, pretty much. If you're filing individual tax return and you made between $91,000 and $114,000, then your Part B premium is going to be $238.10. So as you can see, it goes up. Now that's going to be based on what you made 2 years prior. So from 2020, your tax return from 2020, they're going to look at that and determine what your Part B premium is. While you're retiring, your income's changing. You're not making that money anymore. You can file an appeal to have that change, stating my income was up here in 2020, but well now it's 2022 and I'm making half that. So you can appeal to get that Part B premium back down to $170.10.
And we see this coming into play when people retire because they're going from flying high time or whatever, to just getting their Social Security, 401k, pension, and parceling it out to make it last for the rest of their life. So sometimes people maintain a similar income, sometimes it goes down a bit. And if it does go down a bit, tell me if I'm correct on this. What I've heard is if you are told that you have to pay the IRMAA, the increased monthly amount because of your income, that they automatically send you an appeal form as well, and it comes from Social Security.
I've not heard of them sending a form automatically.
Okay, so you may have to go on the Social Security website and find that appeal form yourself.
Yeah, I've had very few clients who pay IRMAA, but those that have, they've never received a form in the mail. But maybe they just didn't. Maybe they saw it with Social Security and they threw it away. I don't know.
Right, and if you look at the numbers, and you want to talk our flight attendant base pay, if you're just flying your schedule or a little bit high time, you probably wouldn't fall into that income level.
If you're single, you could push yourself over the 91,000 by flying high time and killing yourself, which would push you up to that second level. But are you telling me that very bottom level, the $750,000 or more, that Doug Parker's going to have to pay more for Medicare than I am?
Yep.
I find that strangely comforting.
So is Bill Gates, right?
Are these amounts for the adjusted gross income?
Yes. It's what you filed on your tax return. So after everything.
Right, the adjusted gross.
Yeah.
That's it.
We're
Okay.
on to the next one.
On to the next
Okay.
one.
All right, so the ways that you can cover your the 20% that you're liable for. So back again, original Medicare, Part A and B only cover 80% of your costs. You're liable for 20%. How do you cover that 20%? So Medigap policy is going to be your first option. There's a lot of different types of plans. They have Plan A, Plan B, Plan N, Plan F, Plan G. There's a bunch of different plans. So just depending on which one you go with will determine if you have copays or not. The most popular plan is going to be a Plan F. If you were 65 before 2020, you qualify for that. Or right now it's called a Plan G. Basically, you pay a flat premium. There's no out-of-pocket costs when you go to the doctor. For the Plan G, you'll pay the deductible for Part B, and that's it. But basically, all your doctor's visits are going to be covered. And if you have to have open heart surgery, that will be covered by a Medigap policy, Plan G or Plan F. Those are, really, really sought after. And if you can afford them, then they're great. They're awesome. I refer to them as the Cadillac of Medicare. So we talked about that. Let's see.
And I'll point out that AA does have an 11th option. It's funded by VIBA Trust, which is kind of a retirement trust put together for retired airline workers. And it's just another option that you will have when you retire as a retired airline worker, in addition to the 10 different Medigap plans that are currently available. So not necessarily better or worse. It's pretty comparable, I think, to what's out there in the regular Medigap plan, but it's just another option for people.
The other thing to touch on about Medigap is if you plan on traveling a lot, this is a really great option because there's no networks. As long as your doctors take Medicare, this Medigap policy will pay whatever that 20% is, if it's a Plan F or a Plan G. So they don't have any networks. So if you plan on, living in 2 different states, then that would probably be a really great option for you. We'll go over the other.
That might apply to a lot of flight attendants.
Yeah, I would think so.
I've been meaning to ask you, and lots of flight attendants have asked me, is there any particular Medigap, and they're also called Medicare supplement plans, correct?
Yes.
Okay, so is there any particular Medigap plan which would be preferable if you want to travel a lot out of the country? Is there anything that covers any out of the country
Yes, so,
medical?
Yeah, so most of the plans do cover out of the country travel. Now, depending on the company that you go with, then they will offer certain amounts. So,
But that's just if you're traveling, you can like have your doctor, your regular doctor be in another country.
right.
Just like if you were traveling and something happened, it might cover it.
Right, yeah, and and so it's, like I said, it's a certain amount, and I believe it's over the lifetime of you having the policy. So if it's $100,000, then you only have $100,000 over the lifetime of you having that policy. It's not gonna be every year, you're getting $100,000.
And so it's something to check on as a retiring flight attendant, because a lot of flight attendants either travel internationally, or I've spoken to quite a few people that have residences in other countries in addition to a residence in the US. So if you're going to be living full-time or maybe even half the year, a lengthier period of time, you might want to see, check in. Unfortunately, in addition to Medicare, something that's available in that country.
Kim, I'd like to point out that in our handbook, good slide, on page 32, we have a chart that for all of the plans that are available for a Medicare, Medigap supplement. And it includes the row, does this cover foreign travel? So that's a good place to, when you're looking, trying to figure out which plan.
Good to know.
Awesome. So the next option for you, so you have your original Medicare, you can cover that 20% by a Medigap policy, also known as Medicare supplement. The other option is going to be a Part C or a Advantage plan. These are basically private companies that, similar to like an HMO or PPO, they actually come in those two forms, HMO or PPO. There's some other forms, but those are the two most popular. HMO, you're going to have your networks where you can only see those doctors. You have to have referrals to see specialists. And then, of course, they have the PPOs, which most of us are very familiar with. The PPO, you have in-network and out-of-network availability, a little bit more freedom to travel within the states, and some travel and some out-of-the-country travel coverage.
And we say consult a Medicare advisor, and that's why we brought Phil in today. He's going to embellish on the minimal amount of information we have there, because a lot of people are confused about the differences between the supplement plans and the Advantage plan.
Yeah. Some other things to touch on, but differences between these two plans. So if you have a Medigap policy, again, you'll need to get that Part D in addition to the Medigap policy. So you're, having more premiums. So it is a little bit more costly, but it could be safe. If you have a lot of health issues, it could be safer for you. Again, the Part C and Medicare Advantage plan, it's going to have the Part D built into it.
And Part D is again,
drug plans.
D for drugs.
So you'll have the Part D built into it, as well as some dental, vision, and hearing could potentially be built into those as well. And we're talking about dental insurance.
Yeah, this is scary because historically Medicare hasn't had a whole lot to offer in terms of dental insurance. So that's hence the scary picture. But things that seem to be changing a little bit. When I first started doing this, there was almost nothing available in terms of dental except the options we have up here. And I think through Medicare, they're starting to offer more and more options because they realize that, old people have teeth too, and you need to take care of them. So some options we've discussed in the past are, the company's going to offer you the MetLife dental insurance. It's a retiree dental coverage, and it's zip code rated. It's pretty expensive on a monthly basis, and it doesn't have a high yearly benefit. So most people don't sign up for the retiree dental benefit. What a lot of people do is continue their dental insurance via COBRA for as long as they can, their dental and their vision if they have it, because that enables them to keep their company dental, which is actually not great, but it's pretty good. And try and get all that dental work done while you have the higher level of coverage with the company insurance via COBRA. And you can continue your COBRA, whether or not you're COBRA dental whether or not you're on Medicare for up to 18 months when you retire. And then once that runs out, other options are some of these dental clubs. There's one through the AA Credit Union that's Benefit Services of America, and a lot of people sign up for that. There's another, which is other options are through Costco. People sign up for that one and say it's pretty good. Or, you know, you can go to a dental school and be a guinea pig, and a lot of people do that. It's not for everyone. So, and then Phil's going to talk to you about a few more options that are available or becoming more available with regular Medicare.
So also real quick to go back to the first of the month, if your date of birth is the first of the month, your Part A and B will be effective the prior month. So the month before your 65th birthday, technically. So back to the dental coverage there. So yeah, you can go to dental schools and be a guinea pig. That's a great option for, I've had a few clients do that, definitely. Again, if you're doing Medicare Advantage, this is going to be built into most plans there. If you're doing a supplement, you'll have to pay another premium again. So it's probably going to be less than that MetLife retiree dental insurance, but you're going to pay, you know, for that. But usually you can get that dental, vision, and hearing all built into one plan for a pretty decent price, and that premium rarely ever goes up. It's also going to be, some people call those dental plans that are in addition, they also refer to them as supplements, okay? So onto the vision insurance option. So regular Medicare does not cover routine eye exams. So if you just have original Medicare, no vision insurance, it's not going to cover routine eye exam. You're going to pay 100% of the cost of that. They will cover eye exams for certain medical conditions, such as diabetic retinopathy, glaucoma, and macular degeneration. I'm not a doctor, so don't ask me what that last one is.
I think the important part there is that Medicare will cover disease of the eye. They won't cover ordinary and, you know, just maintenance, my contacts and glasses.
Right. Yeah. None of that. They won't cover anything related to just maintaining your eyes. But if you have a disease, then yes, it will cover something.
That's a bummer.
Yeah. If you choose a Medigap plan, again, you'll need to purchase a digital vision policy, but be prepared to pay as you go if you don't get an additional vision policy. Again, if you choose that Medicare Advantage, the vision is usually included with the dental and the hearing as well.
Okay, so thank you guys. Today it's been a different presentation, but I think Phil's given us some really good information. And we have people that have submitted questions, so I think we're going to let Phil take most of the questions, which is a pleasure. And
I like that.
We like that. We want Phil here more often. So what are the questions, Josh?
All right. So, okay, if I carry my husband's medical insurance, how does this affect annual enrollment if I have to choose my options in October? He turned 65 in July 2023. And this is the questions applicable to both Medicare and the AA.
I'll start with that one. So if your husband is going to turn 65 next year, unless you're retiring sometime next year, again, you don't have to worry about signing up for Medicaid, or if you and your husband both plan to stay on the AA benefits as your primary. So you can, if you're not in the core plan, as we mentioned earlier, go ahead and sign him up for Part A, which is the free, for most people, portion of Medicare, and that wouldn't affect the AA coverage. You probably wouldn't want to sign up for Part B. It would be secondary, and basically you'd be paying twice for the same thing. So I'll let Phil respond to that. But
the other thing I was going to mention about, you said delay your Part B. Also, like, keep in mind, if you are delaying your Part B, you have to apply for that. You have to let them know, I don't want my Part B. Don't let it start, because then they're going to start charging you for that Part B premium. Did you mention that she was working at her husband, or she was on her husband's
No,
insurance?
her husband
He's on
has her.
insurance,
Oh, okay. He has her insurance, yeah.
And she's working for it.
Okay, yeah, it's perfectly fine for as long as if you're continuing to work for American, to delay that Part B. And you wouldn't incur any penalty because it's credible coverage.
So in July, when he turned 65, I know when my husband turned 65, he stayed on my insurance and he received a little card in the mail. I don't know when they send those out because not everybody gets them, but he received a little card and it said, I'm signing up for Part A, but deferring Part B because I have employer insurance, you know, through myself or through my spouse. And he filled that out and sent it in, and that was it. He has Part A, but he'll sign up for Part B when I retire.
Yeah, that is a hit or miss. I would not
Plan on getting
I would
the
not
card.
plan on getting that card because I've had clients that have gotten it and they did that, and I've had clients that have not they didn't even get their card after they turned 65. So, I mean, I would not bet on that. I would highly recommend everybody go on ssa.gov. There is a menu button and there's a tab that says My Social Security. It's a button that looks different than all the other ones. On that website, you can actually say, I want to delay my Part B. On that website, you can order new cards. You can make sure that Social Security has your updated address for when they start sending you your checks or your Medicare card. It's a really awesome place to get everything set up. You can even see your Social Security, how much you're going to make and all of that. When's your full retirement age? Everything is on that website. It's pretty awesome.
Because when you start your Medicare, it's through Social Security, right?
Correct.
It's
yes.
not through Medicare.gov, it's through SSA.gov.
Correct. Yeah.
That's really good information. Okay, where do you sign up for Medicare? Through insurance agency, AA, or through Medicare itself?
So there are a few different ways to do it. Again, you can do it on that My Social Security website. You can actually download the forms off of ssa.gov. You can go to the Social Security office, let them know you want to apply.
Wait all day.
Yeah, I mean, there's a lot of different options. I have people that always call me. They call me all the time and they say, okay, I'm turning 65 in 3 months. What do I do? And I can send forms. I'm sure Kim, I'm sure they have forms here to send you.
I send out the Medicare Part B application a lot.
Yeah.
And the CMS, the employment verification form.
Yeah.
For the special enrollment period.
If you're computer savvy, the easiest way is just to do it on ssa.gov on that My Social Security website. I think that's probably the easiest and fastest way. You'll get your Medicare cards within like 2 to 3 weeks, and have like an effective date already. And then at that time, once you have your effective dates of Part A and B, so for instance, November 1st, 2022, then you can start picking a plan and actually signing up and making that decision. And please don't wait till the last minute.
It's more fun.
Yeah, it's more fun.
If you like stress, like me, wait till the last minute. Otherwise, don't.
Yep.
When giving our notice of retirement to the company, how much time is needed to transition from our company medical benefits to Medicare so there will be no lapse in medical insurance coverage?
So I usually recommend starting the process 60 days out. You don't want to do it sooner because the date will be, it won't show that you had coverage within 60 days. So a lot of people are type A and want to do it way out, but it doesn't really help them to do that. So do you agree that that's about the right time frame? I mean, you can start researching your plans and everything sooner than that.
If I know I'm going to be retiring in, let's say in January, I'm going to start 90 days before I'm actually retiring, because that you can go and apply for that Part B and the Part A and whatever you need to get effective. You can have all of that ready to go and then start choosing your plan and everything for that January 1st effective date.
Even if you're over 65 and you need to show that.
If you're
form.
yeah, so like that's where I would start the process of, because at that time you're going to want to start submitting the form that says, hey, I had credible coverage. I want my Part A and my Part B to be effective on these dates. You want to start all of those things before you are actually going to retire, because If you don't want that lapse in coverage and you're losing that coverage January 1st, it's better to start 90 days ahead of time
Okay.
than wait 2 months, because paperwork can take time, and I just always say give yourself some cushion to not have to make a rush decision.
So 90 days to do your research and start talking to an advisor, and then maybe 60 days to send in the form.
Yeah, definitely.
Okay.
Definitely 60 days. No less.
No
than
less
that.
than that.
Yeah.
I've seen people do it in less, and I've helped people do it in less.
So
and I'm
have
sure you have too. Yeah, that's stress that even I don't enjoy.
Mm-hmm.
All right, next question. If I'm turning 65 and still working full-time, do I need to sign up for Medicare? I read where if I sign up, I need to stop contributing to my HSA. Is that true?
Well, that's an interesting question, because if you sign up for Medicare Part A, you're not allowed to do the HSA. And I want to make sure that we're not confusing things here. We have several different savings plans. One is an HSA and one is an FSA, and there's also the RSA and a bunch of that other stuff.
An HRA
And
and an RHRA if you took the VIA.
But what we're talking about here is the HSA, and if you have that because you're in the core plan. What is it, $5,000 deductible or something? Yeah. So you rarely fall into that, and then you also have to elect that you want the HSA. I have the standard plan and I have the FSA. So it would not affect me at all if I signed up for Medicare Part A, or they signed me up for Medicare Part A because I turned 65 and I was drawing my Social Security. So Phil talked about how you have to tell them that you want to delay starting your Medicare Part B. You can at that same time tell them, oh, and by the way, I also do not want Part A. There's not very many people that this impacts, but if you have the HSA, you do not want Part A. If you get into it, then you are correct. You can't contribute to your HSA, but you could continue if you cancel and say, I don't want the Part
A. Can you go into more detail about the VEBA option, VEBA option?
We have information on the APFA website on the retirement page. It's administered by an outside agency. So if you call me, my number is 817-540-0108, and my extension is 8490, or email me at retirement@apfa.org. I will try and get you more information about the VBAC. Right now, I'd have to go and get it off the APFA website or contact the plan administrators for the most up-to-date information for you.
What was your extension again?
8490.
Okay, I dropped that in the chat for everyone. Okay, great. Next question. Do we get penalized if we do not enroll in Part B at the time of Medicare enrollment, assuming we are still working and need AA coverage for college students? There's a couple questions. We'll do that one first.
Okay, that's kind of a repeat of the prior one. But one of the things we talked about is that, everyone will tell you must enroll. Your sister, she can be so annoying. Get the Medicare and You booklet, which is my favorite Medicare because it's kind of like Medicare for Dummies, and I understand it.
Hot
Some
off
of that
the
other
presses,
stuff.
2023 version.
Exactly. And if you go to page 17 and 18, it says very clearly, if you have employer coverage, you do not need to sign up for Medicare. Show your sister that. I'm not sure it'll help because she's persistent, but yeah. So no, you do not have to sign up.
If enrolled in Medicare, can we still contribute to HSA and FSA? I know you've.
That's yes and no. Yes, you can contribute to the FSA. No, you can't contribute to the HSA.
Are we penalized if we do not elect to enroll in Medicare at 65?
No.
I'm turning 65.
Maybe.
Wait, as long as you have credible coverage.
Yeah,
So
credible coverage.
as long as you have employer coverage, either through American or through a spouse's coverage, you will not, if you delay that Part B, you will not incur a penalty. It has to be credible coverage though. And it's good to look into that because, again, if you're, let's just say, for instance, your spouse's employer is less than 20 people, they may not offer that plan to your husband any longer once he turns 65. So there's a lot of different scenarios where this can get kind of confusing, but it's good to check with your employer. Hey, is this credible coverage according to Medicare?
And the AA coverage, if that's what you're on, is considered creditable coverage for Medicare. So as long as you're still working for the company and you're on AA coverage, that's considered creditable coverage. If you retire and you're over 65 and you're offered COBRA, that's not considered creditable coverage for Medicare. So if you're on COBRA prior to the age of 65, Medicare doesn't really care. They just want you to sign up when you're 65, or if you sign up after, to show the creditable coverage.
Okay. This next one, we've got 3 separate questions from the same individual, so we'll go through them one at a time. I'm turning 65 in October. I plan on staying on till 70. Do I have to sign up for Medicare? Which part?
Again, no, you don't have to sign up for Medicare as long as you have credible coverage through your employer.
This question came in when mentioning Part A. If we continue working but didn't say if we have to sign up for the A, if we are 65 and still working, I guess I don't understand. Do I do nothing since I will be staying on, or do I have to do anything?
You need to so if you received a Medicare card, before your 65th birthday, and it has a Part A and B date effective, I guess October 1st, then if you still plan on staying on American Airlines insurance or your spouse's insurance, you need to let Medicare know that you don't want your Part B to go effective. There's a form you can fill out. You can do it online on that My Social Security website. So again, if you're 65 or older and you're on employer coverage, whether it's through your spouse or through American, you do not have to take Part A or Part B. You can delay both until you're ready to retire.
Okay. And
I don't know how the Part B automatically becoming effective would work, because I haven't really heard of that. But maybe if you're double dipping and you're working and you're also your full Social Security age and taking your Social Security age, there's a possibility they might start deducting Medicare payments out of that. If you're not yet on Social Security, so you're maybe between 65 and 66 or 67, I haven't really heard in that case of them.
Yeah, if you're not pulling Social Security and your Part B goes effective, they will send you a bill in the mail.
Okay,
And they'll send you a bill in the mail for up to 3 months. And if you don't pay it, then they're going to say, okay, well, now you owe us whatever $170.10 times 3 is. They're going to, when you decide you want to go effective later, they're going to say, well, hey, you owe us 3 months so you got to pay that before your Part B goes effective.
Or you can clear that up by saying I still had creditable coverage through my employer, but you have to backtrack and do that. So I guess what Phil's saying, it's preferable to go online and submit that little form with your name and Social Security number that says,
I don't want my Part B.
I'm 65, but I still have coverage through my employer, and I'm electing to defer my Part A, Part B, Part D enrollment until I retire.
Correct.
Okay.
Well, that was kind of interesting because I ran into that last week. If I am paying, if I'm receiving Social Security, they deduct my Part B premium monthly. If I'm hand paying, if I'm writing a check, they don't want to cash my check every month. So they send me quarterly bills. So I have to pay 3 months at a time if I'm handwriting a check. So
but they'll send you a notification. So if you haven't paid that quarterly bill, like that first month, then they'll send you a notice like, hey, you didn't pay it. And then by the third month and third notice, then they'll cancel it, and you still have to owe it later.
So just let them know that you have creditable coverage through your employer and you're deferring your enrollment. That's the easiest way. Then you don't have to mess with any of that.
Yeah.
Okay, third question to really drive it home. Do I have to tell the Medicare that I don't want Part B?
Yes.
Okay.
I guess it's preferable.
Yeah, you need to, if you're not planning on taking Part B, then yes, you need to let them know.
All right. Legacy AA flight attendant. What am I entitled to as far as benefits go if I retire well before 65? I understand the travel privileges. Is there a way to see what I could receive per month with pension, etc., and what other income, if any, I'm entitled to?
Yes, you're in luck. You will, if you're eligible under the 65 plan to retire, you will get travel, as Kim talked about. You can pull up what your pension estimate will be. For the next 3 months, you can go to JetNet and then go to benefits and services, leaving American Airlines, and you'll see a little box that says pension, more information. That takes you to the Pension Service Center. You'll recognize that because that used to be the Benefit Service Center. Now pension is the only thing on there. And you can, in that Pension Service Center, request an estimate. You will be asked for 3 dates. The first date is, when do you want to stop working at American? Last week. Okay, but it actually has to be today or sometime in the future. But it doesn't matter because the pension's frozen, so it's not going to change. The second question is, when do you want to commence your pension? When do you want to start your pension? And, you can pick the month you turn 65, you can pick tomorrow, you can pick the month you turn 69. You can select all of those dates just to see. The thing is, it's frozen. So as long as you're past the age at which they're going to hit you for taking early pension, it's not going to change. And then the third date they ask you for is, what's the birthday of the people you're going to share it with? I'm not going to share it. So leave that blank. And actually, I recommend you leave that blank so you can see what that option is, and then go back. And then when you get it all,
Put your husband on.
Yeah,
Be nice. Your spouse.
Nice, yeah. And then you click go get my estimate, and then go get a cup of coffee. It's going to take 5 minutes. You're going to think your computer froze, but seriously, when it finally comes back, it'll give you all the different options, and there's like 20 or 30 of them, unless you're married, and then there's a lot more. So unless you filled in that birthday, then there's a lot more. And then down at the bottom, it'll say, that was fun. You want to do it again with different numbers? Say yes. And you picked 65 last time, pick 69 this time, and then look over another 5 minutes, come back and say, hey, that was fun. I want to do it again. Yes. Now do it with the putting the date of the person, birthday of the person you want to share it with, and then you'll have it all in one column, all of your options, and that's actually, and then print that out, because when you go talk to a financial advisor, did we say you should talk to a financial advisor?
We did.
Yes, you should talk to a financial advisor. Take that with you, because that will be very helpful in trying to figure out your options.
Also, another place you can view just one option, the single life annuity, which is considered the normal form of benefit for a pension. If you just want to see what that is, you're not planning on sharing, you just want what you're going to get every month for the rest of your life. And your legacy AA flight attendant, you can see that on the Fidelity website as well.
Okay, next question. Can I receive my pension at 65 but not retire yet? Any penalties for that?
It depends.
It depends.
What does it depend on?
Well, if you're an legacy AA flight attendant, you cannot receive your pension until you actually retire. There's one very, very small exception to that. So if you're 65, your legacy AA, you can't commence your pension until you retire. That's the answer for age 65. If you're a legacy AA and you're age 70 and a half or older, there's a very tiny IRS loophole that enables some people to start their pension while they're still working. But it's not something you can put in for yourself. The company will contact you and notify you if you're eligible. It's IRS Rule 131 or something like that. And it applies to people whose pension is greater than their income. And most people working the hard 40 will not have a pension that's greater than their income, because everybody's pension was affected by bankruptcy. So nobody's pension is as big as they want it to be if they're lucky enough to have a pension. The few people that seem to fall into this category have maybe worked a long time prior to the bankruptcy and have a pretty decent pension, and then maybe for some reason they're not playing the hard 40, they've been on medical leave a couple of years, so their income that they've brought in over the last 3 years, and it is an average over the last 3 years, is less than what they would be getting if they got their pension. And in that very, very narrow situation, the IRS says you must commence your pension while you're still working. So
Yeah,
if you
it's
fall
not,
into that category, the company's going to let you know about it. You can't just put in for it if you're a legacy AA person. Now,
yeah, I was going to say that you can't ask for it. The company will tell you. And more importantly, the IRS is telling you must
they're
take your
telling
pension.
them.
I think we're 4.
One year it was 7. It kind of goes up and down,
Yeah,
you know.
but
So.
it's a very small group, and I wish I could start my pension now, but I'm legacy AA and I can't. But what if I'm LUS?
You can start your pension. Why don't you talk about that?
All right. If you are a legacy US heir, and you have not already begun your pension, your pensions are with the PBGC, and you can start your pension. The thing is, if you are not yet full retirement age, and of course that varies depending on which of the 5 pension plans you're in, then if you are not yet full pension age and you start your pension now, you will take that reduction that's built in for starting early. And as long as you don't, as long as you say, I want my money now, I don't care that I'm going to get less for the rest of my life, do it. But if you want to wait until full retirement age, which again is based on your pension, then you can go ahead and start it now. And we call it the double dip, and like a big ice cream cone, it's great.
And for everybody, if you have questions about your pension, we cover it in depth in our normal retirement seminar, and we have several of those recorded on the APFA website. Also, there's a whole list of information about your pensions and the various options for taking them for both PBGC pension holders and LAA pension holders in our Good Slide retirement packet that you can download on the APFA website. Or if you contact me, I'll be happy to either mail it to you or email it to you.
And speaking of recording, this session is recorded. It will be going out via hotline after probably tomorrow or the day after, and then it'll also be on the APFA website. So for any of your colleagues who may have missed it, or if there's some information you want to watch again, we'll have that out. Okay, so I'm seeing a couple of the same type of question. I think there might be some confusion. Regardless of work status, everyone must sign up for medical care at 65, and if we do not, a higher premium will result for life, question mark.
Yeah.
So the question is, regardless of work status, must I sign up for Medicare at 65?
No.
Okay,
No.
because there's a couple people that are
Confused.
asking pretty much the same thing. Please confirm, if I'm working when I'm turning 65, do I have to sign up for Medicare or not?
All right, so let's go over the scenarios. Working at 65 and you have employer coverage, you do not have to take Medicare. You can delay Medicare and not incur a penalty. If you're retiring at 65 and you're coming off of employer coverage, then you need to sign up for Part A and for Part B. If you're on your spouse's coverage, you do not have to, and you're age 65 are turning 65, you do not have to take Medicare Part A and B. When you retire, if you're retiring at 70 years old, let's say, then you want to take Medicare Part A and B at the month that you're retiring. That answers the question.
So if you're working and your company has what's
Insurance.
considered credible insurance coverage, you don't have to sign up.
Is
There are-
AA's insurance considered?
AA
Yes.
insurance
Okay.
is considered creditable. So if you're working for AA and you're on AA insurance and you turn 65 and you plan to work longer, you do not have to sign up for Medicare until you retire.
Okay.
If you're on your spouse's insurance, you probably don't have to sign up until you retire, but it's good to check because there are some companies out there that have their plans structured in order to save money so that those certain employees have to go on Medicare even if they're still working when they turn 65. AA is not one of those companies, but it's always good to check if you're on your spouse's insurance.
So you're saying there are companies that would dump the medical obligation on Medicare by making me go to Medicare at 65?
Oh, yeah, go
Mhm.
figure.
Don't let American hear about that.
Mhm.
Don't give them any ideas.
I have two more pension questions. Can you run the different scenarios and payments after you have made a request for the pension packet, or does this request finalize numbers? Do I need to have decided before I request the pension packet?
Well, you
Yeah.
can request more variations. The thing is, you've made your request. So unless you reach back out to them and say, wait, I changed my mind, you've already made your selection by sending in the pension.
But it doesn't lock you in. You
No,
can request your pension packet, 2 or 3 times a year if you really wanted to annoy the pension service center people. But it's not going to be processed until you actually retire. So if you request your pension packet and you don't retire for 6 months, that pension packet will expire. So it's not going to lock you in. However, there's no need to request your pension packet itself unless you're going to retire, because you can run multiple pension estimates or request them to mail you a pension estimate rather than the actual pension packet. And that doesn't lock you in either. So nothing locks you in. You can run multiple scenarios up until you retire.
So this kind of goes hand in hand with that. Is it true that all calculations for pension payments are adjusted based on economic factors, interest rates, et cetera, at the time of the decision?
I don't think so.
No. On an LAA pension, there's a formula based on how much you earn, how long you had, how much pension service you have, and the magic number, the magic multiplier, which is in the contract and has been the same for the last 35 years.
And it's kind of based on the best 4 years consecutive out of the last 10 years you worked prior to the pension being frozen when we went into bankruptcy in 2012.
Okay. Let's see. He mentioned Part B, but didn't mention Part A. I think this came in a little bit earlier in the session. Do I have to pick Medicare A when I turn 65, though I'm staying on with AA? The answer is
You can,
No.
no, you don't have to take Part A. It's free as long as you work 10 years and put into Social Security. So the only scenario where you wouldn't want to take A, right, is when you have an HSA and you want to continue contributing. That's the only time you want to say, I don't want Part A.
And the HSA is affiliated with the core plan. So to answer your question, from what I see based on my experience, most people go ahead and sign up for Part A unless they have the core plan with that health savings account that they can take with them into Medicare. However, you're not required to sign up for Part A, and you can defer signing up for Part A as long as you have the creditable coverage through your employer. You can sign up for A, B, and D all at the same time when you retire if you want to.
Next question. Any chance of a buyout? I know we usually get this question in every session that we have. The answer has not changed, unfortunately. The company is not interested in a buyout, especially during periods of growth like we see right now, where they're hiring thousands of flight attendants. They need flight attendants. They don't want more off the property. It is a little bit different than what we saw in COVID, where they needed fewer flight attendants than they do now, but we will continue to pressure the company and hopefully we can secure a buyout.
And also, I wanted to mention we're facing a base closure, and I know that your national officers did go to the mat with the company and taking into consideration that they're closing a base and try and get the company to offer another early out, and the company didn't really even want to talk about it. So it was something that was suggested, taking into consideration the really sad turn of affairs that San Francisco base is closing. So we tried, and unfortunately we weren't successful in getting that done.
Thank you for that point, Ken. I'm 54 years old and considering leaving the company. When can I collect my pension money?
I'll take that one. It depends. If you're LAA, you can begin your pension as early as 55 with a reduction, assuming you have sufficient credit and service. If you're LUS, it depends on which pension you started in. And if you go to page 14 in our handbook, you'll see that the early pension age for shuttle, if you're in the shuttle pension, is 52. Piedmont Allegheny US Air is 55, and PSA is also 55. So you begin it as early as age 55. Your full retirement age, which means you won't take a reduction for starting early, is 60 at LAA, 62 at Shuttle Piedmont Allegheny US Air, and 65 at PSA. But if you've got 65-point plans, you can retire now. And retirement and starting a pension are two different steps. So, but you can, if you qualify to retire, you can retire now and start your pension when you're eligible and you want to.
Okay. Pension is best of 4 years of the last 10 years. Is that consecutive years?
It's actually 48 consecutive months. So it could be, instead of 2008, 9, 10, 11, it could be from February of 2008 to,
But it's consecutive.
it's
And it's-
consecutive months, dropping out any 0 months you had in there, but yeah.
And it's the last 10 years before the pension was frozen.
Yeah.
Since the pension was frozen, nothing has affected your pension, other than your age, maybe. Ability to take it and when.
Will I get full payout for my vacation if I plan to retire in November and my full vacation is February 2023?
This is actually a great question because we actually have two different buckets of vacation. We don't think about that all the time. I've got the bucket that I've already bid and I'm going to take in December. Like I'm senior enough to hold that.
3 months.
Yeah, dream on. So I've got the vacation days that I have bid and been awarded, but I haven't taken yet. So like for me, it's going to be January, February, March. And then I have all these vacation days that I've earned, but haven't bid for yet. So I've accrued, but haven't bid for. So I've got these two different buckets. The good news is they're going to pay it out for all of them. So I've got these, all my vacation days in January, February, March. Say I leave on December 31st, I will get paid out for January, February, March vacation because I have bid but haven't taken it yet. And I've earned 12 more months in my bucket. So I'm going to get paid out for all of those weeks. What would that be, like 12 weeks of vacation when I retire on December 31st? So you're going to get paid for all of it.
Yeah, I like to say that anytime you retire, it's like you get the vacation buyout without having to bid for it.
Exactly.
Vacation buyback.
I think, yeah.
Who would I contact about getting paid out for vacation if I retire May 1st, 2023? Would I bid for vacation if I'm retiring?
If you, yeah, I say go ahead and bid for vacation because
In case
if
you
don't,
change your mind.
yeah, in case you change your mind. Yeah. And life happens. You know, you've been in the airline industry a long time. You know that things change. So yeah. But yes, go ahead and bid for vacation. You don't have to apply for vacation pay. It's automatic. The contract says you're going to get it. You will get it.
All right, let's change channels back to Medicare. Can you have Part A if you are contributing to an HSA savings account? We touched on this a couple times.
You can't. If you want to continue.
Well, you can, but.
Well, you can, but you cannot, you won't be able to continue contributing to the HSA.
So don't sign up for
So
it.
don't sign up for A
Have
if
an
you want to
HSA.
keep going.
This is a really general question. I think we can touch on it in a couple different bullet points. Is there something you need to do before you turn 62?
Get your life in order. Oh, wait, no. No, in terms of Medicare,
You need
no.
to think about, in terms of Social Security, maybe this person is thinking about early Social Security at age 62. And you do need to think about the tax implications and the income implications. Could you touch on that, Patrick?
Yes, you can go to SSA.gov and pull up the Social Security estimate. They used to mail it to us, but I don't know, they don't anymore. You can pull up your SSA.gov, your Social Security projections as they exist now based on what you've learned so far. And if you take it, and it says in there, at age 62, you would be eligible for X amount of dollars a month. If you have a spouse, they would be eligible. And it gives you all of the eligibility you have based on the information they have as to the date that you pull that estimate. Again, pull that estimate and take it with you to a financial advisor because there are a lot of things, like Kim says, there's taxes. There's all these things that influence when you should start your Social Security. Are you still working? Yeah. So, yeah, go to SSA.gov and pull an estimate.
But if you're age 62 and you're thinking about taking it early, there's a cap on how much income you can earn before you start getting taxed at a higher rate.
Yeah.
And most people working a hard 40 would be above that cap. So a lot of people might think, oh, I'm going to take my Social Security early while I'm still working, but then they end up getting dinged by higher taxes. So definitely talk to a financial advisor or a Social Security advisor or both before you make that decision.
Exactly.
I'm over 65 and signed up for Medicare Part A. Can I opt out of it so I can enroll in the core insurance and start contributing to an HSA? I plan on working 4 to 5+ more years if that matters.
Probably.
I would think you could,
I
yeah.
think you can, yeah.
You can always cancel your Part A and B anytime you want. So I would assume that yes, you can.
So would you be able to cancel it and then reinitiate it later?
Yeah.
Maybe
Mhm.
during the Medicare enrollment period, could you cancel it, the annual enrollment period for Medicare?
I think you can cancel it at any time.
Okay.
You just have to contact Medicare via my Social Security account or sending in a letter saying, I want to actually cancel my Part A and Part B effective on this date, and then start contributing to your HSA.
And it sounds like this person just has Part A because they're still
Yeah.
working, but they're
Yeah.
thinking of switching to the core plan
So they
for
can,
the last 5 years so they can have a little account to take with them when they go.
yeah, so maybe like, I guess if you're planning on getting on the core plan for January 1st, and to start contributing to that HSA, then you probably want to cancel that Part A before.
On or before January 1st.
Right.
Do you sign up for Part A and B separately or at the same time if you're going to continue to work past 65?
You don't have to sign up for either. So you don't sign up for either of them simultaneously.
But
And if you're going to delay your Part B, you probably want to reach out and contact Medicare and say, I want to defer or delay my Part A and Part B.
So the answer is if you want to sign up for Part A while you're still working because you don't have to pay for it and you're not on the core plan and you think it will be easier to get signed up for Medicare when you eventually do retire because you're already in the system, you can go ahead and sign up for Part A while you're still working, but you would definitely defer signing up for Part B until you retire.
I'll be working until 66 to 67, so 90 days out, I request the CMS L564 from American.
You actually can download it from ssa.gov. That's the best place, but it is available on JetNet somewhere hidden, buried in the Benefits Service Center if you can find it. Maybe on retirement information. I'm not sure where it is. I'll have to look again because they keep hiding it from me.
That might be good to get on the website as well.
And I think we do have it on our
Okay.
website, and I can also, I'm happy to email you the request for employment information and the application for Medicare Part B if you want either of those.
I'm not retiring, but my spouse is. He's currently under my benefits. How does he show proof of coverage to Medicare? Also, would it be financially better for me to drop him from coverage and let him take Medicare at 65?
Okay, he doesn't need to show proof of Medicare coverage until he applies for Medicare. And for most people, they find that staying on Americans' benefits is better. I occasionally hear from people who swear up and down that they're better off on Medicare. More power to you. Medicare will cost you more money than your premiums to American Airlines. But, you know, we all have things we value different. For most people, staying on American is fine. Because he's staying on American, it doesn't matter that he's retired or not retired. He doesn't have to provide any proof of coverage until you decide to retire and your American insurance for him ends. At that point, you'll need to provide the proof of coverage.
Also, in terms of how expensive it is by comparison, if you're on the high cost coverage plan, then definitely Medicare is less expensive. But if you're on the standard plan or in any of the other plans, it's probably somewhat comparable, but a little bit less expensive. Mm-hmm. Is that what your experience has been?
Yeah, and also like on the American Airlines plans, if you have like the dental vision and stuff, like adding those premiums to a supplement is going to just add more costs. And for the most part, a spouse with the employee is a lot cheaper than the spouse going off on their own and doing Medicare. But you can definitely get a comparison done for that, to see what's going to be more cost effective. Like you said, if you're on that higher cost plan, with American Airlines, then it may be more cost effective to move to Medicare.
Well, your premiums are going to be less. But
Yeah.
Medicare is an 80-20 plan, which is not what the higher cost plan is. So that's what a lot of people want, the higher cost plan, so they have less of a copay.
Yeah.
And are willing to pay the higher premiums for it. Doesn't matter when you get to Medicare, it's going to be 80-20.
Yeah. When I say go to Medicare, I mean go to Medicare with a supplement or a Medicare Advantage plan. That's what I'm. Not just original Medicare.
And maybe dental and vision on the side, yeah.
There's a lot of different scenarios to that.
And most of the people that are thinking about Medicare, remember when American, you got to choose between your high cost, standard, and then you also had an HMO option. So every year you had to decide, should I switch to the HMO or should I not switch to the HMO? Most of us don't have that, except for our friends in Hawaii,
California,
Puerto Rico. Sorry, guys in Puerto Rico. Best of luck for you.
Yeah, they're going through a hard time.
Yeah, but in Medicare's a lot, it's got a lot of moving pieces, but actually you're pretty familiar with that because even our simple medical has got a lot of moving pieces too.
When I retire after the age of 65 and my husband is on my AA insurance, is he penalized for not signing up for Part B when he was 65? He's 70 now on Part A.
No.
As long as you can fill out that form and send it to Social Security showing that he had creditable coverage through your employer, he's fine.
So when I retire and my husband is on my plan, does he need to submit my proof of credible individually Medicare?
You retire and your husband is on your plan, you need to send in the form on his behalf. If you're not 65 yet, if you're 65, you need to send it in for both of you, a form for each of you. And it says the employer, and then underneath that it will say if it's for the employee or if it's for employee spouse. And then the company fills out, whether that person has had coverage since they turned 65. Mail it back to you, and when you show it to Social Security, they'll say, great, you're entitled to not having any late enrollment penalties because you've had good coverage through your employer.
That's all of our Medicare questions. We've got a couple.
Regular retirement questions?
Yeah. How many flight hours or vacation and sick time paid out?
4 hours, assuming you have more than 7 days of vacation, and most of us do, you'll get paid 4 hours of flight pay per day of vacation.
As long as your vacation,
if you got more than 6 days.
And the sick?
Sick is paid out.
$8.65 per sick hour. So we always recommend, you might, when you get to a certain age, there's always something that you need to take care of. So we strongly suggest that you use up all of your sick time for a legitimate reason prior to your retirement.
Yeah. Don't call in sick if you're not sick, but you're old, so you've got that advantage.
Still confused about requesting the pension packet. At the time of the request, do I need to specify which annuity option I'm taking or spousal split percentages, or can I get the paperwork before I've decided on my best payout scenario?
There is no way to specify which option you want when you request your paperwork. You get the paperwork and it's actual paperwork, and you have to check a box when you send it in that specifies what options. So no, you do not have to specify when you request your pension paperwork.
So is the payment option decision made at the time of request for packet?
No, it's made prior to sending the packet back to the company.
If I start an HSA and die before I use it all, does it get lost or does it go to a beneficiary?
Well, my strongest recommendation is don't die. But if you insist,
we never recommend that.
If you insist on doing that, when you sign up for the HSA, there is a place to put a beneficiary, and the HSA balance will go to that beneficiary. If you left it blank because you weren't sure you're going to stay with Bozo, the HSA balance will be sent in the name of your estate.
Where did you get that handbook?
Which one? Medicare and You?
Yes.
That is available for download off
Oh.
Medicare.gov and SSA.gov. And every Medicare vendor in the world has a copy of it because it's not copyrighted, available for download.
You guys,
as
I
well.
found
And
it.
if you're old, like my husband, and they're trying to get him to go on Medicare, they send it to him every year.
I found it and I dropped it in the chat so you guys can click on the link and it'll pull it up on your device that you're on. The power of Google.
And I'm telling your husband you said that.
Recommending to everyone they consult an independent Medicare insurance rep in their state. It shouldn't cost anything and you get information specific for where you live. Some insurances don't quote travel should you move.
That is very good advice.
Great advice.
We appreciate you bringing that up. Not Evan.
So where can I go? Who can I contact or phone number, email, anything like that if I have more questions about Medicare?
www.medicare.gov. Phil, where are you licensed?
I'm licensed in the state of Louisiana, Texas, and Mississippi.
So if you live in one of those states, if you email me, I will forward, and you would like to consult with Phil, I'll forward your emails to him and or get you his contact information.
Absolutely, yeah. Happy to do that.
And then there are several companies that flight attendants like to use. One is called Select Quote Senior. Another one is, well, the AARP are good to consult with for Medicare plans. If you have USAA coverage, and I've heard that their supplement plans and so on are good. Who else? Boomer Benefits is another one I've heard of. And then what's the name of your company?
Mine's the Medicare, well, I have Dallas Medicare Specialist and Lafayette Medicare Specialist, but I'm under the Medicare Specialist umbrella.
Okay, okay. So I'm
Yeah.
sure they're a good company too.
Yeah, and we also have agents in other states as well, if they ever need any help.
So if you want a list of people that other flight attendants have recommended, because we don't really recommend from APFA, but I do keep lists of Medicare advisors that other flight attendants have given me good reports on. So if you want a list of what other flight attendants like, I will be happy to send you that list.
Good. Great. Well, we have not received any more questions. We really appreciate you taking time to talk Medicare with us today. I know this has been really beneficial to us. We got some really good comments thanking you guys for this session. We really appreciate it. Once again, this will be recorded and put on the APFA website. We'll have a hotline to go out with it. I'm also thinking that maybe we can look at a couple of these questions that were kind of reoccurring. We can put them in the hotline so those are already highlighted. And then I know you mentioned, a couple different options depending on your age and everything like that. Maybe we can make a table and put that on the hotline as well. So really quick view. So thank you all also for being on. You are why we do this. We are here to help
Thank you.
And we hope you have a really great
And
afternoon.
thanks to Phil, our Medicare rock
Yeah,
star.
thank you. Thanks for having me. Appreciate it.
Any parting thoughts, guys?
No, we just appreciate the opportunity to share some different information, and we got a lot of good questions, so we appreciate it.
Thank you all.
Thank you.